Hi, Jim. My name is Brianna. I want to go over some lab values that were ordered for you. If at any point during our conversation you have any questions, please feel free to just stop me and ask. So it looks like we're going to go over some liver function tests. I'm going to start with the AST. So AST is an enzyme found mostly in the liver, but it can also be found in the heart as well as the muscles and other tissues. High levels of AST in the blood could mean that there's some damage to one of those organs or tissues going on. So we're going to do this test to see if there is or has been any damage that's taken place. A normal range for the AST would be 10 to 40 units per liter. And then some signs and symptoms of high levels is pain in the upper right stomach area, yellow skin and eyes, and feeling very tired. Some signs and symptoms of low levels would be weak muscles, low energy, and although this one is rare, trouble breaking down and using protein. What could your results mean? So it could mean that active tissue damage in the liver, heart, or muscles is taking place. Some factors that can affect these results would be medications like Tylenol or opioids, as well as intense exercise. So before the test, there are no limitations on food or fluids. However, we do want to take a look at your medications just to make sure none of your medications will interfere with the results of the test. During the test, you might feel some slight discomfort from the tight band around your arm or the needle, and then 4 mLs of blood will be collected. After the test, direct pressure to the site to stop the bleeding will be applied, and then you can resume any medication stopped prior to the test. Any questions about the AST test? Awesome. We're going to move on to ALT. So ALT is an enzyme found mostly in the liver. So high levels of ALT in the blood help determine the damage to the liver specifically. So this test is going to be done to see if any damage has or is currently taking place to the liver. A normal range for the ALT is 10 to 40 units per liter. And then some signs and symptoms of high levels would be yellow skin and eyes, not wanting to eat as much, and dark colored urine. Some signs and symptoms of low levels would be weakness, low energy, and low levels of minerals and vitamins. What could your results mean? So, results for the ALT test could mean liver damage or inflammation, or it could also mean fatty liver disease due to the diet. Some factors that can affect the results of the ALT test would be diet such as fast food, energy drinks, herbal teas, or alcohol, as well as medication like acetaminophen, Tylenol. So before the ALT test, there are no limitations on food or fluids. However, again, we want to review your medications just to make sure that your medications don't interfere with the results of the ALT test. During the test, there will be possibly some slight discomfort from the tight band as well as the needle, and then we'll be taking a 4 ml blood sample as well. After the ALT test, direct pressure is going to be applied to the site to stop the bleeding, and then you could resume any medications stopped prior to the test. Do you have any questions about the ALT test? Okay, we're going to move on to the ALP test. So ALP is an enzyme found mostly in the liver, but also in the bones. High levels of ALP in the blood help determine liver bile issues or bone disorders. A normal range for the ALP is 50 to 120 units per liter. Some signs and symptoms of high levels of ALP are yellow skin and eyes, bone pain, itchy skin, and then some signs and symptoms of low levels are numbness, tingling, and low energy levels. What could your results mean? So results for the ALP test could mean that there is a growth on the liver blocking bile flow, or that there is a bone disease. Some factors that can affect the results of the ALP test are diet such as fatty foods and supplements such as vitamin D, as well as age in individuals older than 45 years old. So before the test for the ALP, fasting is required for at least 8 hours up or prior to the test. So no food. You can drink though. And then during the test for the ALP, slight discomfort from the tight band as well as the needle might be possible. And then 4 mLs of blood will be collected. After the test, direct pressure to the site is applied to stop bleeding. And then you can resume your usual diet after that test for the ALP as well. I know this is a lot. Do you have any questions? Okay, so we're going to move on to direct bilirubin. So the reason why we test bilirubin is because high levels of direct bilirubin could mean that there is a bile duct blockage. So the normal range for direct bilirubin is less than 0.5 milligrams per deciliter. Some signs and symptoms of high levels of direct bilirubin would be yellow skin and eyes, dark colored urine, and pale stools. Some signs and symptoms of low levels which that's actually pretty rare, and so there wouldn't be any symptoms. What could your results mean? So the results for the direct bilirubin could mean that there is a blocked bile duct, or a liver disorder. And then some factors that can affect these results are liver toxic medications such as Tylenol or antibiotics, as well as other medications. And then diet, so fatty foods and alcohol. So before this test, continue fluids as usual, excluding the alcohol if you do consume. And then fasting is required for at least 4 hours before testing. So during the test, there may be, again, some slight discomfort with the band that goes on the arm as well as the needle for collection. We will be collecting 3 to 4 mLs of blood. And then afterwards, after the test for the direct bilirubin, there will be some direct pressure applied to the site to help stop the bleeding. And then you can resume your usual diet. Okay, so for total bilirubin, so high levels of total bilirubin could mean that the liver is not effectively handling waste. And so this level will be tested to look at how the liver is functioning. The normal range for total bilirubin is 0.1 to 1.0 milligrams per deciliter. Some signs and symptoms of high levels of total bilirubin are yellow skin and eyes, itchy skin, and feeling very tired even after rest. Some signs and symptoms of low levels of total bilirubin. Again, that's also rare, so there would be no symptoms. What could your results mean? So results for the total bilirubin test could mean liver cell damage, and it could also mean hemolytic anemia. Some factors that can affect results are liver toxic medications such as Tylenol or antibiotics, and diet such as like fatty foods and alcohol. So before the test for the total bilirubin, you can continue fluids as usual. However, you will need to fast for at least 4 hours before the test. During the test, there may be some slight discomfort from the tight band and the needle, and then 3 to 4 mLs of blood will be collected. After the test for the total bilirubin, direct pressure is applied to the site to help stop the bleeding, and then you can resume your usual diet. We're almost done. Any questions? Okay, so we're going to also be testing albumin. Albumin is a protein made in the liver and is one of the most common proteins found in human blood. This level will be tested to determine nutritional status as well as liver status. And the normal range for albumin is 3.5 to 5.5 grams per deciliter. Some signs and symptoms of high levels of albumin are dry mouth, lack of fluids, intense vomiting or diarrhea. Some signs and symptoms of low levels of albumin are edema, which is just overall swelling throughout the extremities or throughout your arms and legs. and then poor wound healing or feeling very tired even after rest. What could your results mean for your albumin test? Increased, it could mean a lack of fluids. And then if it's decreased, it could mean that protein intake is low or improper absorption is taking place throughout the body. Factors that can affect the results of the albumin test are medications such as insulin and aspirin, as well as IV fluids or too many fluids too fast. So, before the test for albumin, no fluid or food restrictions are necessary. However, we will want to review your medications because there are some that we may have to stop until after the test. During the test for albumin, some slight discomfort from the tight band on the arm, as well as the needle, might be possible, and then 5 to 10 mLs of blood will be collected. After the test for the albumin, direct pressure is applied to the site to help stop the bleeding, and then high protein diet is encouraged after that test as well. And then this is the last test that we're going to be looking at. So it's the total protein. Total protein is a measure of all the protein in the blood, and this level is tested to determine nutritional status as well as chronic illness. The normal range for the total protein is 6.0 to 8.3 grams per deciliter. And some signs and symptoms of high levels are lack of fluids, feeling tired even after rest, and some joint stiffness. And then some signs and symptoms of low levels of total protein is fluid buildup causing swelling, as well as muscle loss and brittle hair and nails. What could your results mean for your total protein? It could mean dehydration, or it could mean some long-term swelling, such as like chronic inflammation. Some factors that could affect the results of the total protein test are contrast agents, as well as medications that kill healthy cells as well as harmful cells. So before the test for the total protein, there are no fluid or food restrictions. However, we do want to review your medications because there are some that we may have to stop until after the test. During the test, there might be some slight discomfort from the tight band on your arm as well as the needle, and then 7 mLs of blood will be collected. After the test for the total protein, direct pressure to the site is applied to help stop the bleeding, and then you can resume your medications as prescribed by your doctor. Do you have any questions about all those tests? I know that was a lot to cover. Okay, well, if at any point you do think of questions, just feel free to contact me or reach out to your primary care provider.